So remember, when we're dealing with diagnostic tests in personal injury, specifically personal injury, and especially the minor impact soft tissue injury, we want to pay attention to these 9 diagnostic qualifying factors. And we want to pay attention to them for all personal injury, but especially the missed injury, the minor impact soft tissue injury. Now, the second part is what we call the hybrid subjective and objective findings. And most doctors, to be honest with you, have never heard of the term prior to joining with me. And they make a common mistake thinking that a lot of tests are objective when they are not. And a major part of this, remember, is credibility. It's putting things in their perspective order, and it's credibility. Because remember, one of the ways you're going to be attacked is they're going to say it's totally subjective, that you don't have any objective evidence and it's totally based on the patient. So we want credibility, so we want to be able to distinguish each of these factors and to explain them. So in the hybrid subjective and objective, it's the combination of the patient's action as well as the doctor's interpretation. So it involves 2 people, and so the patient's action could vary, and the doctor's interpretation could definitely vary. An example I give is, if I lined up 10 patients and 10 doctors and had everybody do reflexes and dermatones, I'll guarantee you we will have a wide variety of findings. And that's due to the hybrid subjective and objective nature. If they were totally objective, we would not have a wide variety of findings. But again, it becomes important that you're aware of them for credibility and specificity. This is why. And we'll go into the different tests later, but so just being aware of what are some of the common subjective and objective hybrid findings? Most of the range of motion, the active range of motion, is interpretive. Passive somewhat. Joint motion is not. Muscle testing, yes. That's hybrid. That's physician dependent and on the patient. And when you look at reflexes, yes, that is not totally objective. Dermatones, yes, hybrid. Probably the only reflexes that are not hybrid are the upper neuron motor neuron reflexes, or central nervous system reflexes. So that would be, and then when you get into the orthopedic tests, the orthopedic tests, for the most part, are hybrid. There is one test that is totally objective, and it essentially measures the blood pressure rate. The blood pressure rate. A person cannot control their blood pressure rate. That's an autonomic nervous system. But when the typical test that we do, the compression test, foraminal compression test, those are hybrid tests. So those are your main findings when we talk about range of motion, nerve, muscle, orthopedic test. Same with palpation. For the most part, that's going to be a hybrid type test. Okay.